Have you got yourself a health checkup recently? The hemoglobin is an estimate of the red blood cells in your blood. Normal hemoglobin is 14 to 16 gram% in a man and 12 to 14 gram% in a woman. An anemic person would have tiredness, recurrent infections, and hair loss. Further tests for anemia include blood film retics, iron, B12, folic acid, thyroid tests, liver tests, serum creatinine, stool for blood, urine examination, pelvic examination, bone marrow tests, and other special tests if needed. The commonest cause of anemia is nutritional deficiency. Vegetables don't have B12, and so if you are a vegan, you may need supplementation. Iron deficiency is treated with oral supplements for 3 to 6 months, or IV iron if severe anemia, kidney disease, or poor oral absorption. We always look for a cause of bleed by endoscopy, colonoscopy, and gynecological evaluation. B12 deficiency is treated with injections if severe deficiency, problems with the nervous system like burning sensation in the feet or memory loss, or absorption problems. Oral supplements are given for 3 to 6 months. Can non-vegetarians have B12 deficiency? Yes, if their intake of meat is poor and if their absorption is poor. Can you have B12 and iron deficiency and not have anemia? Yes. Low B12 presents with tiredness, infections, and memory problems. Low iron presents with tiredness and recurrent infections. Polycythemia is an excess of hemoglobin in blood and is caused by smoking. Low oxygen in blood from long-standing illnesses. Bone marrow problems. It presents with clots in lungs and other organs. The WBCs are your defense against infection. When the WBC count is low, we think of infections, B12 or folic acid deficiency, bone marrow problems, certain medicines, immune problems, liver and other problems. The patient could have no manifestations at all, or recurrent or very serious infections. High WBC count is due to infections, certain medicines, immune problems, stress, pregnancy, exercise, and bone marrow cancers. The patient could have fever and infections, or could have no symptoms, or in more serious conditions, lymph node enlargement. The platelets plug broken vessels to stop bleeding. Platelets can be low in infections like dengue, nutritional deficiencies, certain medicines, immune system problems, bone marrow problems, liver, and other problems. Many times a patient has no symptoms at all. In severe cases, they have bleeding from the gums and other organs. High platelet count can be due to occult bleeding, certain cancers, and bone marrow problems. The patient can have no symptoms or have clotting and bleeding problems. More investigations may be ordered by your GP if any report is abnormal. To know more about other tests in your health checkup, please subscribe and hit the bell icon for notifications.